Hey guys, Jareth Smith here, and today I want to talk about meniscus tear surgery or post-surgery rehab, because my pop recently had surgery and I think he and a few of you guys out there may benefit from a rehab program. So these are going to be like basic exercises that you can do almost straight away or a week after your surgery, okay? So first off, I want you to start with the police acronym. So I've mentioned this in a few videos before, but basically it's to bring the inflammation down and start to optimally load the limb again. So basically it stands for protection, so you want to protect the injured area, don't cause any more harm. You want to optimal load it, so basically start partial weight bearing, and wherever feels comfortable, okay? You probably won't get weight bearing straight away, but partial weight bearing with crutches or using something to support your weight is great stuff. And then you want to do ice every ice for 20 minutes every half an hour, that sort of thing, about 4 times a day. Then you want to compress it, so I really recommend compressing it if you're doing exercise on it. And then elevation, obviously prop your leg up so blood comes away from it. I've mentioned this in more detail in other videos and why you want to optimally load it, so if you want to go watch them, just search my channel, I've got plenty of videos out there. After this you want to move on to the exercises. So what the exercises are going to do is we want to increase that range of motion back into the knee and then strengthen it up as well. So the first one is going to be using a towel. You're going to wrap it around the end of your foot, and then you're literally just going to pull the foot towards you and then straighten out your foot. So you're getting a bit of activation of the muscles, but try and use your arms just to pull the range of motion in, okay? So after you've done this, I want you to do this for as many repetitions as you like, maybe 20 repetitions, a few sets, like rest in between each set, maybe 30 seconds to a minute. Go and do it again, 20 repetitions, just trying to get that range of motion back into the knee. So the next one I want you to do is a heel drag. So what you want to do is lay down. You can do this on the bed, you can do this on the floor with your socks on or something like that, or put your foot on something slidey on a slippery surface, and you're just going to slide your heel towards your butt, okay? So once you can do this, you might not get full range of motion at first. Same with the towel, you probably won't get full range of motion, but as much as you can will be great. And you literally want to pull the towel, going onto the heels now, so pull the heel towards your butt and as much as you can, and then go back out to the beginning again and then pull it up as much as you can. I want you to be able to get at least 85 degrees out of that knee before you move on to the next exercises. Research has shown that any less than 85 and you're not ready to start doing strength exercises on it. So make sure you're getting at least 85 degrees of flexion out of the knee and then move on to these exercises. So the next one's going to be an isometric contraction. So you're going to bring the knee in and then you're literally going to push into the floor with your heel and just isometrically contract that limb. So isometrically just means without movement. You're going to contract the hamstrings and push down into the bed. After doing this, we want to do, you can hold this for 10 seconds and then do say 8 to 10 repetitions. Then we want to isometrically contract and isotonically contract the quadriceps. So what this means is, or what this is going to involve, is a single leg raise. So again, in the same position, you don't have to move. You're just going to raise the injured limb up, hold it there for 10 seconds, make sure your leg is nice and straight, pull your toes towards you, and this is going to isometrically contract the rectus femoris, because that's flexion of the hip, and then also of all the quadriceps group all together to do extension of the knee. And basically hold it there, come down, again do 8 to 10 second hold, 8 to 10 repetitions. Then we can move on to the adductor group. So literally for this you're just going to turn on your side and again lift up your legs, same repetitions, same isometric hold at the top, but now we're working the adductor group as well as VMO, which is one of the quads, and this is really going to help pull the patella in line and really help rehab, basically strengthen up that knee, get stability back into the knee. The last one you can do is abduction. So this is where you're going to lay on the other side and then lift your leg up to the side. This is going to work on mostly stabilization of the hip, but that's going to run down into the knee as well. If you feel comfortable with these exercises, I'll do these for a couple of days and then move on to the next one. So basically, when you go into surgery to take your cartilage out, any sort of knee surgery, your knee's going to be unstable, okay? So you want to add in some proprioceptive work, which is basically neuromuscular facilitation of balance. So basically some balance work, basically. And what it's going to look like is add this in a couple of days after your strength. You're going to stand on one leg and then your other leg. So you're going to stand on the injured leg. You're going to use the uninjured leg to move forward, to the side and then back, just to put you off balance a little bit, so you're working on some balance control. And then I want you to switch legs, so then you can work on flexion, extension and abduction of the hip in an open kinetic chain way. That brings me on to the next stage of rehab. So these are just basic exercises I want you to get used to for a few weeks, and then you want to start making more functional training, such as box squats, which is basically standing out of a chair, normal squats, split squats, that sort of thing. So basically you want to progress. I may do a video on this in the future, but I just wanted to get basic foundation exercises in there for you guys to start off with. But yeah, obviously you want to look to progress these into more functional movements. Basically what I've added in here is range of motion to start with the towels and the heel slides, with a little bit of muscle work, and then open kinetic chain exercises, which is basically where your limb is open. It's a free moving limb, rather than a squat where your feet are on the floor and then you're doing flexion and extension of the knee, but in a closed kinetic chain way. That puts more pressure through the knee, but that's what you want to move on to, okay? Anyway, I hope this video helps you guys out. If you have any comments of things I may have missed, things you've tried that have helped you, leave them in the comments down below. Subscribe to the channel if you haven't already. I've got more content like this coming out, and I'll see you guys in that next video.